Hello again, everyone. We're back here at the hemodynamic loop. So this time around we have all of our names in. Still have the initials up here to help serve as a cue for you to remember. But now what we're going to do is plug in all of our pressures, and this should look very similar to what we did this morning. Starting over here in that left heart, some of these numbers will be the same as what we had in the book. The left atrial pressure that's in the book was a 5. And again, we always have to apply some unit of measure. So that's 5 torr. Remember, 1 torr is the same as 1 millimeter of mercury. Okay. So small pressure, just enough to keep things moving forward through the bicuspid valve, opening up to the left ventricle. When the left ventricle contracts during systole, pressure increases up to about 120 torr, and then when it relaxes during diastole, it approaches 0. That 120 torr is a very strong pressure, and it needs to be strong because it's got to move blood throughout the rest of your systemic system. The 120 torr is pushing through the aortic valve, opening it up into the aorta, where again we see that systolic pressure of 120. But this time, when the left ventricle relaxes during diastole and that pressure approaches 0, we've got more pressure on this side of that one-way valve than on the other, and that closes that door. But when that valve closes and seals off the rest of the systemic system, we maintain a pressure of about 80 torr during that diastolic phase. So we always keep a pressurized system here within the hemodynamic loop. That's very important. It keeps blood moving forward, keeps the tissues perfused. We learned in class that we can take a systolic pressure and add it to 2 diastolics, divide by 3 to get the mean. The mean's about 93 torr. Okay. Of course, as we saw also, your blood pressure can go up a little bit and down a little bit. It tends to fluctuate, no big deal. So this number of 93 can change a little bit too, just something to keep in mind. When you guys are doing your blood pressure checks in lab, that's about what your brachial artery pressure is going to be, 120 over 80, give or take. Some of you might be a little higher, a little lower, and you can average your numbers and find out what your number is. That mean was also referred to as the arterial BP. And if we're looking at the mean, we put a line over it and understand that it's averaged. So an average arterial pressure of about 93 in the systemic circulation. That pressure continues to decrease because when we get into the smaller vessels, such as the arterioles, we can't sustain a high pressure because that would rupture those very fragile vessels. So the pressure continues to decrease, and the value that we generally accept for the arterioles is roughly around 30 torr. Here in the tissue bed of the systemic circulation, 20 torr, just as an average number. And then venules, about a 10, give or take. Okay. If we're in between the arterioles and the systemic capillaries, it's probably in the mid-20s, maybe 25s. If we're between the tissues and the venules, it's probably between 10 and 20, so probably in the teens somewhere. Okay, just something to keep in mind. But we continue seeing this pressure gradient that we talked about, that delta P, very important in establishing blood flow and perfusion through the systemic vasculature. We continue up the loop from the venules. They merge together into the veins that get larger, and eventually all of our veins merge together into the inferior vena cava or the superior vena cava, depending on if we're coming from the lower torso or the upper portion of the body. When the superior vena cava and inferior vena cava merge together, it's pretty much right here in that right atrium, we'll see the central venous pressure, and the value we used in class was 2 to 6, average number of about 4, right? That's torr. And that's pretty much the same as your right atrial pressure. They're pretty synonymous. This is kind of an open room here, so you're not going to see that much of a fluctuation or change in pressure. Maybe it's a 4 and it's a maybe a 3, I think is what we looked at in class. So just something to show that the pressure is along a gradient going to decrease. In this right ventricle, though, as the blood moves forward, when the right ventricle contracts during systole, that pressure goes up to about 25 torr. During diastole, it approximates 0. During contraction and that systolic pressure of 25 in the right ventricle, the tricuspid valve closes, the pulmonic valve opens, releasing this pressure of 25 into the pulmonary artery. During diastole, though, when the right ventricle relaxes and the pressure approaches zero, again we've got higher pressure on this side, lower pressure on the other side. It closes the pulmonic valve, but we maintain a pressurized system in the pulmonary system, keeping a diastolic of about 10, which is what I like to use in class for us. So 25 over 10 torr is a pretty average number for an adult pulmonary artery pressure. We can average these just like we did over in the systemic system by taking 1 systolic and 2 diastolic. So 25 plus 10 divide by 3, and we got that average of 15. That's your mean pulmonary artery pressure of about 15. It will gradually decrease. We could put maybe a 12 here and a 10, and by the time we get into the pulmonary vein, we're at an 8. And you'll notice here the pulmonary vein has an 8. The diastolic pressure was a 10. That's just kind of a trick that I'll teach you guys later, is that we can estimate pulmonary vein pressure by simply taking the diastolic pressure of 10, subtract 2 from it, and you can estimate a pulmonary vein pressure. All right. The pulmonary vein pressure of 8, as you see, is just a little bit higher than what we have here at 5. And as you guessed it, that takes that blood forward. Right. But I think we've got all the pressures in here. I would practice this and memorize it and learn it well, because we're going to use it a lot throughout the rest of the program. Thank you.